Hello everyone, Dr. Naveen here from UPSC Medical. We are back with another previous year paper discussion. This time it is 2023 paper, and as you all know, I have been doing analysis of the previous year papers starting from 2019 onwards, right? So in the last 5 years, what I have realized is it is very important for an upcoming batch. For example, here it is 2024 batch who are going to give their exam in less than a year of time. They should have a baseline idea about what is the future paper going to be, what are all the important topics that they need to stress upon, and also not only from optional point of view or medical science optional, even UPSC general studies also, the whole basis of UPSC revolves around previous year questions, right? If you master them, let me be more precise. If you master previous year topics, right, the more chances that you're going to score high, right? This is the smarter way of preparing for UPSC because the syllabus is always never ending. You need to identify those areas or zones wherein if you revise them multiple times, if you understand them, if you practice them with the help of test series, I think you're going to score well. So this analysis is very important for 2024 target students and also future budding doctors who want to get into UPSC journey. If they want to know what is the trend or the pattern of the medical science optional papers, if you just watch this video, you will understand and how UPSC pattern of asking questions and evaluation is different from our board exams or theory exams, university exams, right? So you'll understand the difference so that you can fine tune your preparation according to the need of the exam. And one more important thing is for 2023 target students who have already given mains, for them they can analyze how their paper went, what are the areas wherein they performed well, and what are the areas they can improve if they want to give a next attempt. Uh, the exam cycle runs in 2 years, not 1 year. Even if you are not willing to give your attempt in 2024, the results will come 1 week before the prelims, right? So you have to continue your preparation till the next prelims. So meanwhile, based on this analysis, you can fine tune or change preparation according to the future uh, pattern of the exam. Okay, we can predict that with the help of analysis. So with this basic introduction, let's get into the overall review of the paper. First, I'll give you overall review, then we'll get into subject wise analysis of questions. So wherever possible, I'll predict the future possibility, like what are the topics that you need to focus in 2024 based on that. And before starting, we all know that repeats have always been there in the range of 75 to 85%, right? And 100% of the paper is within the syllabus. Sometimes you might feel that by looking at a question, it is out of the syllabus, but again, if you understand the depth of the syllabus, then you can come to a conclusion that all the questions in the paper are within the purview of the syllabus which is given by UPSC. Now, what you need to do is before starting your preparation per se, if you're starting fresh now, you need to understand syllabus, and there's a video in YouTube channel of UPSC Medical of understanding syllabus and books to read. Just go through it, then you will realize the fact that though the syllabus looks huge on the paper, if you know the demand of the exam, then you can fine tune your preparation according to that. Now, second thing is, it is important for me as the academic director of UPSC Medico to tell you that the strike rate from courses and test series is 85%. Why I'm stressing upon this fact? The reason being, if you have a standard guidance, standard material, standard videos, and standard test series available for you, I think this makes your job so easy because throughout our 5 years of MBBS or any medical field, we have 100% focus on medicine. But when it comes to UPSC, medical science optional is only 30% of your weightage. Most of the times, general studies they take up 70% of your time, preparation time. So when you look at the syllabus, when you understand the syllabus, when you think that it's easy, But actually on the ground, what happens when you don't have guidance or mentorship or support material on the table, it takes a lot of time for you to segregate resources on your own and be ready for a competitive exam like this. So uh, my sincere suggestion to you is, if you do not have any financial constraints, okay, let me stress upon, if you do not have any financial constraints, take help of UPSC Medico because the strike rate is high. Okay. Uh, Before starting preparation itself, I know every doctor thinks that let me do it on my own, not only for medical science, even for general studies. So we all start with a prefixed notion that it can be done by us. I'm not discouraging you, it can be done by you, but look at the level of the competition and the amount of time it takes. If you want to save time and if you do not have financial constraints, better to take the help of any resources available so that you can crack this exam early, okay, on the time factor, and also the process becomes smooth, right? So that way we have a 85% strike rate. I'll give you all the questions which covered in the notes, videos and test series, with while we are analyzing the paper in a subject wise fashion, you will understand the strike rate. But my sincere suggestion to any fresher or any new student who is not part of a UPSC Medico is, make use of a ready-made resource to save time, right? So next, this time, in comparison to the previous year papers, last 3 4 years, paper was too clinical. But again, when I say it's too clinical, you need to understand that paper two paper 2 was a little bit on the tougher note. Okay, maybe for an MD MS doctor or a post intern MBBS doctor who is good at clinics, it is easy. But for a just passed out MBBS student who is not so good at internship, or a fourth MBBS student, or non MBBS students from BDS, BAMS, BHMS background, they used to find paper 2 a bit difficult and more on the clinical side. But this time paper 2 was relatively easy. Yes, there are clinical questions, but the diagnosis you can predict very easily. And also when they said diagnosis, they clearly said what is the diagnosis, that's it. They asked for only 2 marks. Previously they used to ask differential diagnosis of this case and they used to allot 5 marks. This time they made it very easy, just you have to predict the diagnosis and put it there. It's only for 2 marks, all the diagnosis questions. And diagnosis is relatively easy, and most of the clinical questions are repeats, and non-repeat questions also we covered in the test series. So that why most of the students who messaged me or called me after the mains 2023 exam, the optional part, they were pretty happy with paper 2, right? Paper 1 was mainly on the anatomy part, was a little bit on the tougher side in comparison, but again it also has 85% of the repeat rate. But problem here with paper 1 is the unasked version of questions. I call this as hashtag unasked. Okay, whenever I say this in this video, you have to presume that these questions are within the syllabus but not a repeats. So unasked questions are more in question number 1 and 5, which are mandatory questions. Okay, we'll also deal how to tackle these kind of questions in the future, right? So these are rare possibilities. You cannot go run after rare things and waste a lot of time. Okay, they are of low yield. Always and always focus on repeats. But again, as I said, 25% of the paper is not a repeat, so it is very important or high time for you to understand that there is no I have seen many of the students in the last 3 4 months who just started their optional preparation. They are running after last 5 years of papers. Let me tell you, yes, last 5 years of papers are high yield. As you can see, 8 repeats from 2022, 21 repeat questions from 2021, 10 repeat questions from the year 2020 paper, 13 repeat questions from 2019, and 11 repeat questions from 2018. Yes, there are repeats, maybe direct repeats some questions, and there are more indirect repeats from the topics. Okay, and this unasked version questions are also an indirect ramification of the previous year question. So you have to understand the depth here. Instead of just mugging up previous year question papers, you have to understand what could be a future possibility. Okay, you have to predict that and you have to prepare according to that. And in this preparation, I think it's important to attempt all the test series papers, because in UPSC Medico we are trying to predict that and frame questions. Okay, so in that way you are even ready for that 25% of the unasked version. And even in videos also, video discussion, most of the videos are, yes, previous year paper based, but on top of that, if there is a future possibility or we do get into a detailed discussion of the particular topic which is asked. Okay, so when we get into that details, I think you will get 2 to 3 marks of extra knowledge so that you can outbeat your competition, right? So this is one thing I want you to take home. Paper 2 is relatively easy. Paper 1 is little tough in comparison, but overall paper was easy. It can be done. It is easy to score. Okay, and microbiology, this time the weightage was high. There's so many questions, infectious disease questions, and when I say infectious disease questions, again you have to understand the fact that in India, in a country like India, in a developing nation, okay, infectious diseases, communicable diseases are always very important diseases, right? Starting from tuberculosis, malaria, dengue. On basis of these three diseases, tuberculosis, malaria, and dengue, there's so many questions and there's so much of weightage. These are common diseases seen, and for a medical student like you, it's easy. It's easy and it can be revisable. You can easily learn these topics like tuberculosis, malaria, and dengue. Common topics they're asking. Now, there was previously a trend of asking explain why kind of questions in pharmacology, but I didn't see any that kind of questions this time. Like why for example, clonidine should not be stopped suddenly, or why aspirin should not be given along with warfarin. So these kind of questions were there, but the whole basis of these questions is drug interactions. And if you are my UPSC Medico combo course or test series student, you do understand the importance of these drug interactions, and most of the questions in test series from pharmacology are based on drug interactions, and the same thing got repeated this time. They asked two questions for 10 marks. One was aspirin and other was cyclosporin, and in that for example, in pharmacology syllabus, if you open your syllabus book and see, pharmacology syllabus has only two things. One is mechanism of action and side effects. These are the two headings under which they have given the whole list, but they have from previous year paper analysis, what we observed is they're also asking therapeutic uses. Okay, therapeutic uses, and now they're also asking, very importantly, drug interactions. So this drug interactions is an indirect way of asking explain why kind of questions, and they did ask drug interactions of aspirin and cyclosporin. And when I gave pharmacology test 3 paper, most of the students were furious on me for asking so many questions on drug interactions. I told you both drug interactions and antibiotic resistance are future. Okay, future possible questions. Maybe next year they will ask you mechanism of antibiotic resistance of particular drug. Be prepared for that. We did cover this in the pharmacology discussions. Okay, aspirin and cyclosporin was the question. This is that one take home for 2024 batch, that you need to focus on drug interactions. Very important. And again, there are no ortho questions. Okay, there's no ortho chapter in the video course. Okay, there's no ortho notes in the book. The reason being they're not asking questions from the 4 topics of orthopedics. And in last 3-4 years, what I observed is there were some questions on DNA bill, MTP Amendment Act bill. In the last 2-3 years, we have seen these kind of questions on bills. So in the test series, I tried to cover new bills like surrogacy bill, which was latest, right? Which is relevant to the medical stuff. Okay, and also ART bill was there. Okay, ART bill, the new bill. But this time they didn't ask any current updated related question or bill or program. They went very safe, pretty basic paper. And one more thing, to all my video course students, I tell them that UPSC CMS questions, they form a strong basis for UPSC CSE Medical Science optional, but the board being same. Okay, that's the reason I predicted these two questions, that is National Framework for Malaria Elimination and Janani JSSK program, not JS5. Most of the students are getting confused with Janani Suraksha Yojana from JSSK. You have to understand the difference, and this question was also a prelims question this time. Okay, prelims, if you can remember. Now, see, these two national programs were there in the UPSC CMS 2022 paper, and they are also part of test series. And this time, because we could predict it and we could give it there, most of the test series students were happy with that. Because always PSM or SPM is a dilemma. We don't know what kind of questions they're going to ask in the future. Okay, if someone calls me and asks me, sir, what to prepare for PSM, the many students, 40 to 50 students, ask me like what to go ahead with PSM. I told them, go with the nutrition, go with TB program, very important one. Whatever is the future probability, go with the Kala Azar program. So there's a question on nutrition, anemia related question was there. Now national framework for malaria elimination is direct repeat from UPSC CMS question. So those MCQ based questions, you have to understand the depth of those questions, and you can predict PSM from that. Mainly PSM, not others, but PSM part you should look at the UPSC CMS recent paper. Okay, now national framework for malaria elimination, JSSK, part of our test series questions. Okay, now this is it. Now after completing the whole analysis, I'll tell you what are the questions to attempt. Okay, these are the probable questions. Maybe if you're not a part of UPSC Medical and you gave your exam, I cannot predict like what stage of preparation you are in, but for my students, whatever I told them, whatever questions I tried to cover in test series, and based on the previous year paper analysis, these are the safest questions to attempt in paper 1 13578, in paper 2 13568. If you have chosen these questions, the chances that you score high, because most of the questions here are previous year paper based or PYQ based, and some unasked version is covered as a part of video course and test series. Okay, these are the predictable important questions, and this is very important from a UPSC medical science aspirant point of view. You need to pick the right question based on the weightage, because as per the instructions, we all know 1 and 5 questions are mandatory, and you have to pick 1 or 2 questions from each section. Okay, let me not get into that details, but again, which question, the point, like for example, if you take if you look at top of video of Dr. P. Srija, All India Rank 20, she was stressing upon this fact that you have to choose right question to score high. It's not about how much knowledge you have, it's not about how much you revise. You need to pick the right question on the day of the exam so that you score high. So on the heat of the exam, when you're so stressed, you might not, your brain might not work in a right direction, so that you end up choosing a wrong question, wherein the other question might have given you 40 marks, you are choosing a question 30 by 50, okay, instead of 40 by 50. So choosing a right question to attempt is very important. And yes, if you ask me, for example, if you're preparing for 2024, you have 2023 paper analysis, now you have 2022 paper with us. If you want to choose among two, you have to be a master of 2022 paper, not immediate. So repeats are not so high from an immediate paper, but the penultimate paper, that is like for example, if your attempt is in 2024, master 2022 paper. If your attempt is in 2023, you have to master 2021 paper, because most of the direct questions are from 2021 paper. And again, last 5 years of papers are very important. So what I'm doing now, I have already given you model answer for 2022, 21, 20, right? Now I'll be uploading to all my students in couple of days the 2023 paper model answer also. Okay, and I'll also give you 20 right, 2019 model answer also. So let's master last 5 years of papers for the upcoming attempt of 2024. As you can see, most of the questions are directly from the last 5 years of papers. You can go to last 10 years, you can go to last 20 years. Actually, last 20-year papers is the basis for my courses, video course plan A, plan B, plan C. Combo course contains little extra content, new topics, predicted topics, and also test series video discussions will be there in combo course. But as I'm talking about video course plan A, plan B, plan C, it's mainly based on the previous year paper analysis of 20 years. So I'll be uploading the 2023 model answer in a couple of days for all the students, valid students within the window period. Okay, and also I'll give you 2019 model answer also. 2019 models answers are already included in the video course and notes, but I'll just separate them and I'll give you as a separate handout so that you have all the model answers ready. Okay, they form a strong pillar or basis so that you can revise these questions in the last 5 days or 1 week between your mains and optional time period, right? But students are finding it difficult to revise in the last 5 days of time, so I'll make it easy for you people by doing that. Now with this intro discussion and also general analysis of the paper, let's get into the subject wide discussion. This time I want to go very fast on these aspects. Okay, first thing is anatomy. As you all know, 70 marks weighted. This time anatomy, I'll not call it as a bouncer, because let's finish the analysis of the paper. We'll come back on the analysis of anatomy, because anatomy is always unpredictable most of the times. When I started this UPSC Medical Coaching Institute long back, I had seen a question on arches of foot. Actually, foot topic is not there in the syllabus, but I don't know why arches of foot has come up in the exam. Similarly, very recently, there was a question on bronchopulmonary segments, because thorax is not there in the syllabus at all. Yes, there are some questions like 10-15 marks weightage questions. Suddenly they're giving up. I don't know why anatomy professors or exams paper setters are they're discouraging us as medical science optional students. The problem, I'll tell you, if they give 20-30 marks of paper questions, this is happening only with anatomy. So, okay, we can only blame anatomy professor who is giving that particular question, or any surgeon who is giving an anatomy question. Please let me be very frank. If you give an out of boundary question, actually anatomy and general surgery, both these subjects are lengthy in UPSC medical science optional syllabus. If you do not limit yourself within the purview of the syllabus, and if you give a bouncer question like this for 20 marks or 30 marks, that too in paper 1, question 1 and question 5, what happens when you give it in a mandatory section? Most of our students are at a disadvantage. So we end up scoring 285 to 290 instead of scoring 310 to 320, right? So this is the problem if they give a rare question or out of boundary question. For example, as you see, question number 1A, explain the role of tongue in swallowing. It might look easy. You can talk about the oral phase of swallowing. You can give intrinsic muscles of the tongue. So you can definitely give an indirect answer, but nowhere in either in let's say the physiology or either in anatomy section, we are not stressing upon this role of tongue in swallowing. It can be a clinical anatomy of tongue. You can ask that question. Okay, any diseases or applied aspects of tongue, you can ask that. But suddenly they gave this. Similarly, instead of asking lymph node supply of the tongue, okay, lymph nodal supply of the tongue, they're asking you an indirect question on what are the principal lymph nodes involved and its further distribution. Now, CA oris as a whole, we have 5 levels of lymph nodes: level 1, 2, 3, 4, 5. If you are a 2022 test series student, in general surgery, I did ask a question on what are the levels of lymph nodes in the neck, and in carcinoma of oris in different areas, what kind of lymph nodes they get involved. And actually, we could predict this question, but it should be asked in general studies, general surgery, oral cavity tumors, or it can be asked in pathology wherein you have CA oris, histopathology, and risk factors, but not here. Okay, they kind of try to integrate it, and don't feel bad if you haven't attempted this question. This is a tough question for most of the students, but again, look at the weightage. You are lucky, it has got only weightage of 10 marks. Okay, it has got only 10 marks weightage. So the first question is a clear cut CA oris, okay, oral cavity serous. Where is the ulcer located? It is in the tongue. That's it. The whole history is given to just consume your time, okay, and also give you a general idea how this cancer presents. But the question is, what are the lymph nodes which are involved, and also what is the role of tongue in swallowing? So how to attempt this question? You can just start by writing up the lymph nodal supply of tongue, which is again within the purview of the syllabus, because gross anatomy, blood supply, and lymphatic drainage of tongue is there in the syllabus. And you can also write about intrinsic muscles of tongue which help in movements of the tongue. So when tongue moves, okay, intrinsic muscles of the tongue, not extrinsic muscles. If you can name them, you can write about their innervation, that is hypoglossal nerve. Okay, at least basic answer you can give with your anatomy knowledge. At least you will get 5 or 6 marks out of 10 instead of leaving this question altogether. So this is how you have to approach these kind of bouncer questions. At least you will get half marks for that. So it's there in the syllabus: gross anatomy, blood supply, and lymphatic drainage. There are multiple questions from this topic in 2011, 2015, and 2017. Instead of giving a specific question, you can work on non-specific things in this particular question. Now, describe the following in the context of auditory pathway. Describe the following in the context of auditory pathway. I feel like the question paper is set up by an ENT surgeon this time. Okay, maybe ENT surgeon was asked to give you anatomy paper, so that's why he is stressing upon two things. One is oral cavity and other is auditory pathway. Yes, auditory pathway is there in the syllabus. Again, don't take me wrong. In the anatomy, neuroanatomy, if you are part of my test series, I did ask a 20-mark question on optic pathway and its lesions. Okay, and its lesions. Now, in the syllabus, if you open syllabus book and see in the anatomy, the pathways and lesions associated with sight and hearing. This is the heading of the topic which is given in anatomy syllabus in neuroanatomy. Okay, so I was able to predict, like I was able to double guess that they might ask optic pathway because that is more important, but they asked about auditory pathway, and auditory pathway you all know, right? E. coli ma. A little bit of PG knowledge for for aspirants who are also preparing for NEET PG or just passed out interns who did ENT posting. They do understand auditory pathway is easy. E. coli ma. That's what they're asking. Course from internal ear to auditory cortex. That is E. coli ma. It's pretty simple. But blood supply of auditory cortex, I don't know why they asked this question, because blood supply of brain is not there in the syllabus. Okay, maybe I think I want to put this 5 marker as question which is out of the syllabus kind of thing. Okay, now next question is, these are the two things, that is 20 mark weightage from question number 1.A, 1.B in the anatomy. Next, we are only discussing in a subject wise fashion, not in a question wise number. Okay, in a subject wise fashion. Now question number 2, let's run fast. Now what is this? Question number 2. A 56-year-old male visits surgery OPD with complaints of difficulty in passage of urine, especially on straining. Based on his clinical examination and ultrasound findings, he is diagnosed with BPH. Okay, benign prostatic hypertrophy. What is the anatomical basis? We did discuss this in detail in BPH video of general surgery again, and relations of the prostate gland, and also blood supply and lymphatic drainage of the prostate gland. Prostate gland is very important part of the syllabus, and they did ask a question in 2021 about what are the gross features, lobes, capsules and ligaments, blood supply, lymphatic drainage and age changes associated with prostate. Okay, and also when you read about prostate in the clinical anatomy, you also read about BPH. What is BPH and why there is BPH? I think this is easiest question they can ask from prostate, and it's a repeat. Now question number 3.8.1, that is again from anatomy. We all know there's no anatomy paper without a question on joint, that is hip, shoulder and knee joint. So this time they asked the question on knee joint, and both are a repeat. For example, in 2019 they asked a question on ligaments. In the ligaments we did discuss all the ligaments in detail. Anterior cruciate and posterior cruciate ligaments, what is unhappy triad, what are the orthopedic tests that we do for cruciate ligaments, what is their attachment and all, along with the images there in the notes. Okay, so they're asking what are the movements, what is the role of cruciate ligaments in movement and stability. You have to elaborate on that. And also locking and unlocking is like the kind of the easiest they can ask, and it's also a repeat from the test series. Okay, in the test series, it's a test series anatomy question. There is also a video from Med Campus which has almost, I think, 150k views. It's simple video. I did record it when I actually started teaching for UPSC Medical Science. This was my first video on YouTube, and it has got almost 150k views, right? So this locking and unlocking has a history to hit, and it is very easy question. So they asked this for 10 marks. Now next is carpal tunnel syndrome. It's a direct repeat from 2000 level, and also we did ask this question, carpal tunnel syndrome, in the test series. What are the causes, structures involved, and what are the clinical features of? Very easy question. And this is a bit tricky again because it is from question number 4. You can ignore, right? Again, as I said, hashtag unasked. What is this hashtag unasked? As I told you, these are within the syllabus but not a repeat questions. This year in test series, okay, in the anatomy, the first question is on undescended testes, because we were thinking in the lines of embryology more, because in the question paper we asked 2 questions. One is undescended testes and other is malrotation of gut, because these are the 2 areas, development of gut and development of gonads, both testis and ovary, and abnormalities associated with it. So in this topic, development of ovary testis, there haven't been any recent questions, okay, after 2009. So then we thought that they might ask these questions. Now you say, describe the development of testis in 2009. So you can discuss about the development of testis and its descent in a general way. The problem here is we all know SRY transcription is very important. There are many PG questions on this sex regulating region of Y chromosome, right? How it regulates that there is birth of a male baby. So these kind of things are important from PG point of view, but we will not go into such a depth for medical science optional. The problem here is the weightage is for 10 marks. Okay, so because it is in question number 4, if you are a smart student, you might have ignored this fourth question as a whole, but again it's up to your choice. But such a depth of what is the role of SRY transcription factors in the testicular development is too deeper question. Okay, we cannot go into such a depth. Even if we read also, we tend to forget it. Okay, I'll cover this in detail in the model answer, you don't have to worry, but again you can leave this question. And similarly, there was a question on we did ask about malrotation of the gut. Similarly, there was a question on what are the vital end duct abnormalities, which connects midgut again. If you remember that, if you are preparing for PG, there is Meckel's diverticulum, very important topic. Okay, Meckel's diverticulum is a remnant of the vital end duct. If you can just mention that and talk about Meckel's diverticulum, okay, I think you will definitely get 3 to 5 marks. But again, it's a question from hashtag unasked. Okay. Done. We are done with the anatomy. So overall, paper looks anatomy questions, they looked on tougher side. For example, testicular development and vital end duct abnormalities was asked, and again carpal tunnel was easy, knee joint was easy, and prostate gland were repeats. So these 3 questions are repeat. So this auditory pathway and optic pathway might be a future possible question. So please learn it in detail. I already asked this question in the test series. Now what you have to do from just anatomy point of view, we have to get into further details of learning anatomy and integration. As you can see, this question is an integration from pathology, little bit of physiology of swallowing, and this question is an integration again from general surgery, because BPH, prostatic carcinoma are topics from general surgery, right? So there is little bit of anatomy and surgery integration, that is more applied aspects. So even paper 1 is becoming clinical here. Okay, you have to understand that importance, and you have to plan your or strategize your preparation for anatomy according to that. Next, biochemistry, there's no surprises at all. Folate trap was asked previously, and every year they have a trend of asking vitamin. Okay, they asked vitamin D last time, vitamin C before that. Now they're asking folic acid and vitamin B12 before that. So every year they're asking a new vitamin. So if you want me to predict the next vitamin, just look for vitamin E, because vitamin E was not asked so far. It's not important, but again, because it was not there in the previous year vitamin questions, it can be asked in the future. Okay, now folate trap is again a question from test series, and folate trap was asked in 2018. And copper, as I said, along with the vitamin, you have to also be ready with minerals. For example, we did ask question on zinc, acrodermatitis enteropathica. There was also questions in the test series from selenium. Okay, and similarly Wilson's disease, we all know how important it is for PG preparation, and also from a general medicine point of view, right? So now they did ask a question on what is the role of copper in the body, and what is Wilson's disease, and what are the biochemical investigations associated with that. Maybe in the future, in the next coming exams, if they want to ask a mineral, there are some important macro and micro minerals for the body. There was a detailed classification question which was asked in the test series. Just go through it, what are all the micro minerals, and which can be asked in the future. They can ask fluorine next time. Okay, so also look at arsenic, can be asked in the future. Okay, so this kind of they're asking an unasked vitamin and an unasked mineral. Okay, so try to predict that and prepare according to that. Now genetic code and wobble hypothesis, direct copies from Grantest paper. If you haven't attempted live Grantest 2023, the chances that you might miss this. Okay, what is the genetic code and what is wobble hypothesis? And again, post-translational modification of proteins. Most of the students, they got confused it as post-transcriptional, because that was commonly asked. Please don't get confused. The same post-translational modification of protein is question from subject wise test 5. Okay, So post-translational modification of protein and live GT question, that is genetic code and wobble hypothesis. It's a repeat from 2012. Now, TCR and clinical applications, please don't ask me. It's a regular question. It's a routine question. And again, this is also liver function test. Once they'll ask you hemolytic anemia. Next time they'll ask you hepatitis. Next time they'll ask you cholestasis or obstructive jaundice. You have a clear table in the notes differentiating these three things. If you can just copy paste that column of cholestatic or obstructive jaundice, that will serve the purpose. And it's a frequent repeat. It's like from anatomy they'll ask a joint question. From biochemistry they'll ask a question on liver function test, jaundice. It's a routine way of asking questions in UPSC Medical Science optional. And next is role of iodine. Again, it's a repeat. Thyroid function test. In the organ function test, we have three things. One is liver function test, other is thyroid function test, and other is kidney function test. Maybe this time they're asking liver function test and thyroid function test. Every year they're repeating it. That's why test series I tried to cover even kidney function test. What is the role of serum creatine? What is the difference between blood urea and serum creatine? How do you estimate creatinine clearance? What is glomerular filtration rate? So I did ask a lot of these questions. I also covered them in the video course. Maybe future they'll ask kidney function test because they haven't asked kidney function test in last 4 to 5 years, right? So that's how. And look at the number of thyroid function test questions they asked. Okay, in the recent past also 2022 there's a question on thyroid function test and the diagnosis of thyroid disease. This way they went into specific about Hashimoto's thyroiditis. Previously they asked about Graves' disease. So they're asking specific question, like, but again at the end of the day biochemical investigations and all are same. You have to understand the concept of thyroid function test and thyroid hormone synthesis in this. And finally, one more vitamin, right? After folic acid, vitamin K, and also vitamin K analog, coumarin analog, warfarin. What is its basis of action? It's again a kind of integrated way of asking a question. Okay, and vitamin K was already asked in 2019. What are the clinical deficiency manifestations and what are the laboratory investigations? Again, predictable biochemistry. No surprises, I think. Almost everything is covered either in the test series or notes, right? So let's go to the next part, that is physiology. Also physiology, I could feel that the weightage is less. There's no diversified questions. Almost every question is a previous year repeat. Okay, it's very easy. For example, cerebellum, many times they asked 10 marker questions. You need to be a master of cerebellum and basal ganglia, okay, in neurophysiology, very important. Now next, sleep physiology. We kind of I also uploaded sleep physiology 1.5 hour video, I think, right? 40 minutes of video. Even in YouTube also it is also trending, neurophysiology of sleep. I went into greater detail of why REM sleep is a paradoxical sleep. What are all the neurotransmitters which are involved in the genesis of this sleep? So they did ask about that. Describe the genesis of REM sleep and why is REM sleep called paradoxical sleep. And sleep physiology is very important and a dictum topic from physiology point of view in medical science optional. Because I'm doing this for last 6 years. I'm with medical science optional. I know, like, these kind of questions, they look so simple for me because I know the mindset of the examiner now by looking at the last 20 years of the papers. If you know this basic dictum topics and if you are thorough and prepared with that and you also practice them with the help of the test series, I think we are good to score high. This is, I felt that it's a little bit unfair, but again, don't think that it's out of the syllabus. Clearly in the syllabus of physiology that gave that physiology of menstruation and pregnancy. You know, for 2024 live GT, what I do is for each year we conduct live grand tests. In 2023 also conducted just to predict this hashtag unasked version questions so that the students are ready. Okay, in 2024 I have already started putting up some questions. In that I did include physiology of pregnancy. Okay, because what are the physiological changes that occur during pregnancy is a very important topic from NEET PG point of view. I also teach for NEET PG students, so I have idea about how important the respiratory changes, cardiovascular changes seen in pregnancy, blood clotting factors which are changed. So these kind of questions, I tease them a lot. I know the importance. I did frame a question for live GT 2024 because already 2023 paper was so tough. I didn't want to include some of the unasked questions. Not many people have submitted paper thinking that it is way too hard because it included most of the unasked questions. So that's why I kind of I'm ready with this question, but for 2024, but examiner was ever ready, okay, before me. So he suddenly gave this question. I felt bad because I have framed the same question, but I couldn't put it in the exam. Looking at the weightage also, right? But students might feel it so tough, but it's a predictable question because physiology of menstruation every year they're asking what are the follicular changes, okay? What are the luteal phase changes, what are the follicular phase changes in the uterus or in the breast, okay, this kind of question. Suddenly they went into asking what are the pregnancy related changes that you see in breast, pregnancy related changes that you see in the uterus, okay, and also pregnancy related changes in the blood. It's easy because if you know the physiological anemia, what happens to 20% of dilution, 40%, you have statistics from OBG. I think from OBG anemia answer you can score 5 marks. Genital organs, again, if you have a general idea of that during pregnancy, because of the effect of estrogen and progesterone, there is breast hyperplasia, hypertrophy, and all areolar changes, and all. You can predict that uterus also, uterus becomes softened. Physiological changes during pregnancy. We have different signs, which is also asked in OBG test series. Okay, subject-wise test series. Goodell sign. Bluish discoloration, Osiander sign. So these kind of signs also you can mention. I think you can also attempt this with that basic knowledge. And why there is physiological anemia, blood and blood its constituents, you can definitely answer a little. But again, cardiovascular changes, what happens to the cardiac output? Okay, we didn't discuss this. Let me be very frank with you. These are covered in bits and pieces elsewhere, but not as an unique entity. But I felt bad after seeing this question because I was ready with this question for the next exam. Okay, but you can definitely score 7 or 8 marks out of 15 with the basic knowledge, whatever you have. But it's there in the syllabus. Physiology of pregnancy is there in the syllabus. This is easy again, but the 2-3 students were confused. Sir, what is this intrinsic? Because again, cardiac output simple, right? We have stroke volume, preload and afterload, myocardial contraction, sympathetic system. So we did discuss these kind of things. You need to understand one very important thing, that cardiac output is controlled both intrinsic way. Intrinsic means within the heart. Extrinsic way from external influence. Extrinsic means autonomic nervous system, sympathetic and parasympathetic, and also hormones. So you have to focus mainly on intrinsic. Even if you do not know about intrinsic, if you can just write the answer which is given in the notes and also subject wise test, what is that physiology test number 4? It's a straight question from our test series. I gave you a table, preload and afterload changes in stroke volume, heart rate changes and all. If you can just mention that irrespective of this, it's good to go. You'll definitely get 8 or 9 out of 10. And by looking at the repeats, I don't need to stress upon the fact that this is the most important topic from physiology. They're asking it every time, the cardiac output part. And maybe next year they might ask you differentiating of homeometric versus heterometric. Okay, cardiac regulation. I know this, but I'll not tell you. Just type it in the comment section of the YouTube just to see whether you're following the video or not in detail. Just what is homeometric or heterometric cardiac output? If you can just type it in the comment section, I'll just read it and I'll reply it there, the difference. Maybe the future prospect. They might ask you, describe the homeometric regulation of cardiac output or heterometric regulation of cardiac output. The future possible questions. And again, erythropoiesis, very important. It is from the topic development, regulation and fate of blood cells. Similar questions were asked in 2003, 2013 and 2020. Now, vasopressin, very important, posterior pituitary. And also regulation of vasopressin secretion. In the subject-wise test, we did cover functions of vasopressin and oxytocin and what happens in the deficiency of them. And in general, hypothalamo-pituitary axis, how it is regulated, what is the regulation of vasopressin secretion, and we also did ask about the vasopressin receptors. Vasopressin is also ADH, right? The ADH receptors in the kidney, and also vasopressin receptor antagonists also we did discuss, because antidiuretics is there in the syllabus of pharmacology. So vasopressin is always important. As you can see, if you have anterior and posterior pituitary hormone, growth hormone is commonly asked. From posterior pituitary, every time they're asking vasopressin, as you can see, posterior pituitary. This is again ADH, vasopressin, posterior. So it's a frequent repeat. So again, glucagon. This is again little different for students, but again, luckily we did cover this question of glucagon in subject-wise test. Okay. Why? Because glucagon is secreted by pancreatic islet cells, right? So it's a endocrinology, the dysfunction and regulation and secretion of pancreas. When we talk about pancreas, we always think in the lines of insulin, but pancreas also secretes glucagon. Okay, so you have to learn about that in detail. And we did mention about the mechanism of action and the physiological function of glucagon in this answer. How is glucose homeostasis maintained in the body? It is again, what is the hormonal regulation of blood glucose level? These are covered in the notes. Okay, and also in the 2021 model answer. You can just mention that. That's it. This will conclude paper 1 section A in detail. And in paper 1 section A, I think apart from anatomy, the physiology and biochemistry questions were easy, okay, from previous year questions. Now let's quickly get into paper 1 section B, that is pathology. Pathology weightage was 50 marks. Now this is now you need to understand that in the syllabus they did mention neoplasia. In the older focus guide which I gave you in the first and second edition, I did included other topic, that is cell injury and cellular adaptations. Why I included that? I included that because cell injury and cellular adaptation, because there was a question in 2000. There was a question in 2000 on metaplasia, anaplasia, dysplasia, hyperplasia. Okay, hypoplasia. So these are all cellular adaptations. Okay, hypoplasia and hypoplasia, atrophy and hypertrophy. These are cellular adaptations. Maybe when they are asking questions on neoplasia, they are asking differences of other terms also. For example, even in subject-wise test, of pathology number 2, I included this question: what is dysplasia? How it is different from metaplasia? I do understand the importance of cellular adaptation, but suddenly I didn't expect it to be asked in a general sense. So what are the 4 disturbances of the growth, and what is the mechanism of atrophy? Mechanism of atrophy in general they're asking. I think this is offbeat question. You can at least answer 4 disturbances of growth, but mechanism in detail is not possible. But for future possibility, I'll definitely in the future discussion I'll definitely include cell injury, reversible and irreversible, which was asked previously. Okay, and also cellular adaptations, we'll also discuss that along with the neoplasia, which is there in the syllabus. Most of the times they're asking questions on neoplasia, but as you could see question in 2023 on cellular adaptations, it is important for 2024 batch to have a general idea about that. I think maybe the examiner might have got confused here, because in 2009 onwards the syllabus got changed. Before 2009 there were questions on cell injury and cellular adaptation. In 2009 a major change happened in medical science optional. They have removed these topics, but because the database has these questions, I think even the paper setters are getting confused, and they are confusing us. Okay, it's the, I don't know whether to blame them or abuse them for this. I don't understand, because it's not then the syllabus per se, cellular adaptation. It's only given in disturbances of growth and thing and all. Maybe I had to understand the syllabus in greater detail to tell you whether it is a part of the syllabus or not. But again, it is a PYQ. It was there in the previous focus guide. I removed it in the latest focus guide because I wanted to include only questions from 2009, because any question below 2009 it is removed from the syllabus. But suddenly because of system generated or database generated error, the question is popping up and it's kind of killing our 5 marks or 10 marks, right? So I think we have to be ready for all these misnomers. Otherwise slow and slowly getting into 300 zone for medical science optional student becomes difficult. It's not that medical science is tough. It's only thing that these kind of biased questions are coming in question number and question number 5 to make our life miserable. Okay, so for 2024 batch, what I'm trying to do is I'll also do a 20% discussion on these biased questions and also unasked version. I'll stress more on these things so that you are ready for the exam and you are. It's my duty to make your job easy to score 300 plus in the optional, right? So these kind of questions will definitely affect the overall score. But don't take me wrong, these are look at the weightage of these questions, 5 marks, 10 marks here and there, so only 20-30 out of the scope. You have 470 more marks with you to score 300. So just looking at these basic simple questions, don't blame optional as a whole or your examiner as a whole. Okay, but again, it's very important that these kind of questions shouldn't come up. Okay, the basic questions. Okay, these are basic. I'm not telling that these are research or futuristic questions or current update questions. These are pretty basic, but again, because once you get into medical science optional preparation, you tend to forget basics. You focus more on general studies. The knowledge on medicine slowly and steadily as the years passes by, it kind of goes into loss of memory state. So that's the problem actually. But if you are a freshly passed out student, if you have strong basics, these kind of questions are easy to answer, and you are the right person to stay in the final list. Now we are discussing the pathology part. The next question is, what are the 5 risk factors for oral cancer? It's a repeat. What are the morphology of oral cancer? It's a 2021 direct repeat question. Yes, for the last few years I have seen oral cancer because it's the number 1 cancer in India. TB number 1, oral cancer number 1. You'll definitely see questions on these topics. Enumerate 5 causes of membranous glomerulonephritis. Describe its morphology. We did discuss this separately in a video. It's there in the notes and it's a repeat. Membranous nephropathy. Maybe next time they might ask you membranoproliferative glomerulonephropathy or IgA nephropathy. One glomerulitis, the glomerulonephritis, they'll definitely ask. If not that, they'll ask nephrotic syndrome or nephritic syndrome. Okay, be ready with these renal things. Next, don't get frightened or scared by looking at this question. This is actually AML M3 question. Okay, AML we did discuss in detail about the classification, WHO classification, FAB classification, and very importantly, when you discuss pathophysiology, M3 type of pathophysiology we remember. M3, it presents with multiple bruises and gum bleeding, epistaxis. They're all pointing to AML M3. Even if you don't know it's an M3 variety, just by mentioning AML, it's okay, because R rods are seen in AML, azirophilic granules and R rods. The diagnosis is simple. Staining, yes, cytochemical unfavorable and favorable prognosis. It's a very important PG question also. Prognostic factors are there in the notes itself. Just go through and have a look at it. And diagnosis we did discuss in detail, AML. I thought that they're going to ask CML, but suddenly they have come up with CML is more commonly asked. Leukemia is there in the syllabus. Okay, leukemia. In leukemia, only leukemia is there in the syllabus. I had seen many students asking me, sir, what about Hodgkin's lymphoma? Lymphomas are not there in the syllabus. When I say leukemia, you have to prepare only acute. Okay, acute leukemia and chronic leukemia. In acute leukemia, AML is commonly asked. In chronic leukemia, CML is asked. Okay, I'll not call it as chronic leukemia now because the terminology is changing. CML is in myeloproliferative disorders and all. And for a UPSC medical science aspirant to have a knowledge of hematology at such a depth, it's actually not an advantage, it's a disadvantage because it's a waste of memory. Just read AML and CML in detail. They're only asking questions between these two. Okay, you don't need to know so much about what is happening with the field of hematology, which is ever growing. And you know how headache is hematology to teach for a PG aspirant. The level of AIMS or INSET questions in hematology are a big headache even for a tutor like me, right? So definitely I don't want you to get into such a depth. Just briefly understand what is AML, CML, the terminology, the diagnosis part, prognostic factors, and treatment also. Try to learn in detail because leukemia is also there in general medicine. Okay, the heading of leukemia, they did give it. So etiology, clinical features, diagnosis and management of leukemia is there. and also histopathology presentation here, morphology here. Okay, you have to learn in detail. The same thing I gave here. Etiology, pathogens, histopathology, clinical diagnosis and management of leukemia. In that, AML and CML are the two questions which are recently asked. In 2012, they did ask in detail M3ML. The same thing got repeated in a clinical way, or rods, azorofenic granules. And we did ask about AML M3 in detail in the test series also. If you have attempted test series, you will understand this. And we did discuss this in the notes and videos. Now, finally, rheumatic heart disease. Still, India is like not India per se. Examiners are fond of rheumatic heart disease. We are slowly getting into developed nation because of the penicillin prophylaxis, because of antibiotic treatment for the sore throat. The cases have come down, but still the questions are coming up. Even in 2022, they did ask about this question, and now also they're asking, and they're also asking these questions in PG also because it's a favorite examiner topic. Pathologists will love to ask you questions on rheumatic heart disease because in pathology labs they do have these gross and microscope specimens to teach for the students. But as clinical doctor, we're not seeing many RSD cases now. More of congenital heart disease cases are ischemic diseases we see, not rheumatic heart disease cases. That's it. This will conclude pathology. So, what is your general idea about pathology? Because they asked rheumatic heart disease this time, go for ischemic heart disease next time. And also because AML, try to learn about CML in the future. Again, different types of glomerulonephritis, as I already told you. Oral cancer, they're repeating every time. Oral cancer, cervical cancer, breast cancer. These are three things. Out of these three, you'll definitely get one question. Okay. And this is again, it's up to you whether to get into the details or not. So this is simple about the pathology part. Let's get into quickly the pharmacology. This time it was very easy. There's no explain why questions and simple classification of antihypertensive drugs and what is the role of calcium channel blockers in the treatment of hypertension. We did discuss it in greater detail, the overall hypertension in an integrated way in our videos and notes. It's a repeat from so many years. And again, aspirin, as I told you, drug interaction has come up. So be ready with drug interaction of all the prototype drugs in the syllabus. For example, drug interaction of metronidazole, drug interaction of rifampicin. So you have to be ready with drug interactions for the next year. And again, cyclosporine is a commonly repeated question, but again, look at this, drug interactions has come up. And now insulin, this insulin or oral antidiabetics. Every year there will be one question because you know diabetes, very common disease. In not only in India, worldwide it's a common disease. What are the therapeutic indications and adverse effects of insulin? It's a direct repeat from 2021. Again, potassium sparing diuretics. From diuretics, every year they're asking the question. Last year they asked about furosemide, before that thiazide. Now they're asking potassium sparing spironolactone. Okay, we did discuss this in the video course in detail. What is the mechanism of action of spironolactone, potassium sparing diuretic. Now finally, zidovudine. This is, I think, we did cover it with the help of the test series and also in the general discussion also. All the anti-HIV, that is what we'll call HART, highly active antiretroviral therapy. What are all the drugs we use in NNRT, NNIRT? So these kind of drugs, examples, and what is the mechanism of action, and what are the adverse effects associated with it. We do have a table. I copy pasted that table directly from Harrison in the notes. Okay, just go through it. You will understand the therapeutic indications and adverse effects of zidovudine. And again, it's a 2007. They did ask about what are the toxicities of different antiretroviral drugs. Now next is microbiology. There's so much weightage on microbiology because microbiology and infectious diseases of general medicine, they're trying to integrate them together. Microbiology and also cellular and humoral immunity is there in the syllabus. And as I told you, many students ask me, sir, why there is a detailed discussion on immunology? Because in our video course, not only cellular and humoral immunity, mediated immunity, we did discuss about hypersensitivity, we did discuss about autoimmunity, we did discuss about immunological intolerance, we did discuss about immunoglobulins in general. So we did have a broader knowledge on immunology because suddenly the question of immunology is popping up in question number 5, which is a mandatory segment. So in this, now you see, they did ask about type 4 hypersensitivity reaction. In 2015 and 11 also, they did ask a question on type 1 hypersensitivity. So it's very important to learn hypersensitivity reactions in detail. In PG, it's a common question. In NEET PG microbiology, there will be definitely a question on hypersensitivity reaction. But for us also, it's very important to learn, and it's covered in greater detail in our video course. Clinical diseases caused by typhoidal and non-typhoidal salmonella. What is this diseases caused by? As I told you, microbiology, if you look at the syllabus term, they say diseases caused by and disease caused by and lab diagnosis. These are the two things they'll give you. Now, what is the future of microbiology questions? I'll tell you. Yes, they'll ask you what are the diseases caused by. They'll also ask you pathogenesis. In the past also, you might have seen what is the pathogenesis. The pathogenesis of, I think, Aspergillus was asked in 2019. Now this time they asked about pathogenesis of Cryptococcus. Okay, mostly pathogenesis they're asking. In the lab diagnosis, they're focusing more on the specimen part. Like what is the sample collection? Like for example, last year they asked about CSF processing method. Previous to that, they asked about stool processing. So you have to focus on sample collection method, processing of the sample, staining of the sample. How will you stain it and how will you observe it? What are the cultural characteristics of that and what are the biochemical reactions associated with it? When I say this, under all these headings, I have given you answers for all the microorganisms in the microbiology. If you just go through it on a superficial level, it's okay. But now they're getting into the depth of the specimen part. Like how will you collect a stool sample or CSF processing, how it is done. So you have to understand that. And serological, Vidal test is very important. Like even in test series also, this time we did predict this question. So Vidal test and its interpretation. And what are the diseases caused by typhoid and non-typhoidal salmonella. Okay, salmonella paratyphi. You know, right? Food poisoning and all. You can just easily mention that. It's a 5-marker question. And typhoid is a common thing in India and it's a frequent repeat starting with 2019, 20, 21. Next, 25-year-old male, emergency, fever, neck stiffness, headache, vomiting. So it looks like meningitis, neck rigidity was present. See, this is cobweb formation. Cobweb formation, it's actually a NEET PG 2022 question. Cobweb in the test tube, when you made CSF sample to stand out, there will be a cobweb forming in, and it's characteristic of TB meningitis. If you open MedCampus MedPix, you will see the picture in the first column itself, the cobweb. TB meningitis and also lymphocytosis is seen in tuberculous meningitis. Decreased glucose is seen in tuberculous meningitis and increased protein is seen in. These are all characteristic of TB meningitis, right? Characteristic features of TB. And in India, TB meningitis is more common. They're asking you what is the diagnosis and what is the stain that you use. Okay, what are the different stains we use for diagnosis of TB? You have to just focus on that. And also gross pathology. TB meningitis, I asked for 10 marks in the subject wise test too. Okay, TB meningitis. You have to draw the diagram of tuberculoma. Okay, basal exudates are more commonly seen in tubercular meningitis. You have to divide this. The gross and microscopic. In the gross part, you have to elaborate it. The gross pathology is a direct question. We did predict in subject wise 2 this year. And yes, it's straightforward question of TB meningitis, TB, malaria, common diseases, dengue. So they were not going beyond these things. If you are a part of my test series student, I did ask about sporogonic cycle. And many of the students got confused. What is this sporogonic cycle? Just to be on the safer side, most of the students, they were dying both sexual and asexual phases of the life cycle. Okay, so asexual life cycle is in man, sexual life is in mosquito. Okay, here they're asking you asexual life cycle of Plasmodium falciparum. So if you can just mention pre-erythrocytic and erythrocytic cycles, it's okay. Please don't mention exoerythrocytic cycle here. Exoerythrocytic cycle leads to hypnozoites. Hypnozoites, they lead to relapse, and relapse is not seen with falciparum. Relapse is seen with vivax. So relapse versus recrudescence is a part of test series question. And sporogonic cycle. So if you just write that and if you understand, man, I think the problem here is students might get confused about sexual and asexual. They might draw the sickle cell gametes, leukinate and all, which is relevant to the mosquito cycle. So this is actually specific to the asexual life cycle. If you're confused, draw both. Okay, at least you'll get 80% of the marks. And this is again a straightforward question, rapid diagnostics test. I did ask it in the test series for 15 marks. What is the lab diagnosis of malaria? And write the answer with a special focus on rapid diagnostic tests in detail. You know, right? Rapid diagnostic test, the optimal test, parasite F test, along with the images I gave it in the model answer. You have to elaborate the advantages associated with. For example, simultaneously you can also diagnose falciparum, right? In this by using LDH stick and all. So we did discuss this in the model answers and also in the regular video course. And life cycle and diseases caused by laboratory diagnosis of plasmodium, they're asking life cycles also, so you have to be ready with life cycles of plasmodium, any parasite, and also giardia life cycle is also important, entamoeba life cycle is also important. Okay, amoebiasis. Now let's go to the next question. Human herpes viruses. This is again actually it's a question for I'm actually kind of leaking these questions, but it's a question for 2024. I have already designed it. Why? I'll tell you. When you look at the syllabus of microbiology, in the virology part, there is herpes. That's it. They just gave herpes. What it is? Because in the herpes family, you have many other viruses. For example, is it herpes simplex or is it herpes zoster? Right? You need to understand the difference. If you only go by the disease, that is herpes is actually herpes simplex virus. That's why till now they didn't ask any question on herpes zoster or any other herpes virus. Okay, but I did open the microbiology textbook and I did read about the herpes virus family as a whole. Okay, there is a classification of herpes virus family. In that you have herpes simplex virus. So they're asking you that what are the human herpes viruses with their primary target cells. If you don't understand it in detail, you can just mention herpes simplex 1 and herpes simplex virus 2, and you can just mention the sites, one above the umbilicus and other is below the umbilicus level. You know this, right? You can, if you could just mention that also, you'll get easily 2.5/4. But in greater detail, if you want to get into the classification of herpes virus, it's again I'm asking that question in the next, and I also include this in the model answer sheet. Now, diagnosis of HSV infection, lab diagnosis, you know the steps, right? HSV is a predicted question. That's why in the test series, subject-wise test 1, microbiology, if you open the test itself, the first question is differential diagnosis of genital ulcer and lab diagnosis of herpes simplex virus and how will you prevent it. Like it's again predicted in the subject-wise test 1. Now, discuss the management of complicated falciparum malaria, cerebral malaria. Like look at they asked it many times and we did discuss in greater detail in the video course. Morphological characteristic of Cryptococcus. Okay, India ink preparation. You need to understand the principle of negative staining. Do you remember this question from test series? What is the principle of India ink or negative staining in Cryptococcus? Why I asked this question? Because if you only know that, then you will understand the morphological characteristic of Cryptococcus examination. Why it is staining negative? Okay, what is the reason behind it? And discuss the pathogenesis of cryptococcosis. We did discuss the pathogenesis of cryptococcosis, aspergillosis and all. And cryptococcus is a continuous repeat. Even in 2021 also they did ask this question. Define meningococcosemia. Yes. Describe the laboratory diagnosis of acute meningococcal meningitis. Briefly write about meningococcal vaccines to prevent the disease available. See, vaccination is not a part of paper 1. Vaccination is a part of either PSM or immunization part of pediatrics. There was a question in test series about what are the vaccines which prevent CNS infections. In that we did discuss meningococcal vaccine in detail in the test series. You can copy that here. Yes, again it's an integrated question, but lab diagnosis part and meningococcosemia you can happily cover again, right? So meningococcus, there's so much of focus on meningitis. TB meningitis question was there, and now you have meningococcal meningitis. So meningitis and encephalitis topic is very important. Japanese encephalitis, I thought that they might ask Japanese encephalitis this time. That's why I included this in the paper 1. But again, pathogenesis, lab diagnosis of all this meningococcal is asked previously, even in 2020 also. That's it. Extensively covered microbiology. The reason being microbiology is integrated into infectious diseases. And also immunology is a part of it. That's the reason if you open our test series subject wise test 1, people find it very tough because sir, there are only 9 microorganisms and suddenly you're asking so much about the microbiology. I tell all my students that you cannot read micro alone. Micro is integrated with infectious diseases part of general medicine, plus you have to read a little about immunology, because when you understand immunology, then the serological diagnosis becomes easy for you, because lab diagnosis part includes serological diagnosis. So that way subject wise test is an extensive paper for you, but it's a must attempt and we have covered most of the questions there. Now forensic medicine and toxicology, this time it was pretty easy, almost repeats. Blood group systems used for identification. You see blood groups, how many times we did discuss this. Okay, and next is classify the various types of poisons. It's a direct subject wise test question. Enumerate features of lead poisoning, plumbism. We did cover this. Okay, and what are all the, right, lead poisoning, even important in NEET PG, lead poisoning. This time they're asking lead poisoning. Next time be ready with arsenic poisoning. I thought that they might ask arsenic poisoning. That's why I included arsenic poisoning in the test series. But they went to lead. Maybe next time they'll ask arsenic, or maybe after that they'll ask mercury. The problem with poisoning topic as a whole in forensic medicine and toxicology is there's no cutoff or boundary for the syllabus of toxicology. Yes, they're asking repeat questions. For example, in 2012, they asked about chronic lead poisoning, right? So it's included in the grand test, live grand test 2022. I asked about lead poisoning in detail, acute lead poisoning, chronic lead poisoning, and all. So it is a repeat, but again, if you want to predict future questions, be ready with arsenic, mercury, and lead are commonly asked in NEET PG. That's why I'm telling, because examiner, the paper setter might be interested with PG kind of learning also, right? So they might ask these kind of questions, they might pop up because they are not asked yet. You have to put them in unasked version, hashtag unasked. Okay. Now hurt, grievous hurt is easy again. There's so much questions on grievous hurt, and this is a little bit offbeat. Secondary markings and fire bullet. I'll try to cover this in the model answer. Now different types of finger impressions and short note and fingerprinting. Actually, I loved this question just by looking at this question, because if you open the syllabus book of UPSC, they give just fingerprinting. Just see that in the book. Now you're confused. Well, is it normal fingerprints on the hand, or is it DNA fingerprinting? So every year till now, they're asking about DNA fingerprinting, DNA profiling, DNA fingerprinting. So even we thought that it's a DNA fingerprinting, and we started teaching that. But in test series, if you open and see subject wise test 2, pathology and forensic medicine, I did ask a 10-mark question on what are the common fingerprint patterns. What are the common fingerprint patterns? We have voles and, right. So it was asked for 10 marks, and what is its significance? And after looking at this question, I was very happy that even if it is for 2 marks, but by looking at the syllabus and understanding it, we were able to predict the future possible questions, and it's making job easy for the students. Okay, it's there in the test series again. And I had received so many messages from my students saying that almost everything is from the notes, and we were able to predict most of the questions from the test series. The direct repeats from the test series. Now, this is a lengthier part, paper 2 section A, general medicine, for 90 marks. What are the clinical features of dengue? So there's no paper without dengue, malaria, TB, right? What is the management of dengue? Easy. So many times the question has come. Symptoms of schizophrenia, very important. There is a recent update in the daily answer writing program. We did discuss in detail about the new updated diagnostic criteria for schizophrenia. But again, they're simply asking what are the symptoms, but look at the weightage, 10 marks. Okay, there's so many classification systems, and each symptom is dealt in detail in the videos and notes. Just go through it, you'll understand. And they have little, in psychiatry, they only have 4 or 5 questions. So every year, till last year, they used to ask what is the non-pharmacological management of anxiety disorder or pharmacological management of panic. So these kind of questions they used to ask. Now they're asking on the symptoms of schizophrenia. Next time they might ask symptoms of generalized depressive disorder or maniac disorder. So when they ask symptoms, be ready with the DSM-5 diagnostic criteria. Okay, so you should always mention symptoms from the diagnostic criteria. Okay. Now second, we're discussing general medicine. First part is done, the 1.b. Yes, 1.a and 1.b is done. Now we have question number 2, low grade fever, it means chronic headache, weight loss, low grade fever, weight loss for 1 month, and there is diplopia and altered sensorium. Diplopia and altered sensorium for the last 2 days. What is the most likely diagnosis? What is the most likely diagnosis? Here there is no, what is this? There is no neck rigidity, okay, to call it as meningitis. Definitely there is diplopia and altered sensorium. There are CNS effects, so it is a probable case of meningoencephalitis. Okay, meningoencephalitis, because of the chronic nature, low grade fever and weight loss. Where do you see low grade fever and weight loss in a 30-year-old female in a country like India? Most probably it is TB, meningoencephalitis. Okay, because it's not only meningitis, it is TB, meningoencephalitis. What investigations do you do? It's pretty simple. How do you approach a case of encephalitis? And they're giving you a clue whether it's pyogenic or tubercular or viral. We know viral and pyogenic, they present in an acute manner. Tubercular, it presents in a chronic manner like this, 1 month. Simple. Here itself they have to differentiate, and you know the importance of the table differentiating different CSF findings. And what is the treatment for TB, meningoencephalitis? You have to write about ATT plus steroids which are given. Okay, very important. And here the diagnosis or investigation is not microbiological. Don't give the tabular form of sample, everything like this which we give in the notes. It's actually purely clinical based diagnosis, wherein you have to give more importance to CT, MRI, lumbar puncture, CSF analysis and all these kind of things. They outweigh over the sample collection, cultural characteristics, biochemical characteristics. Don't mention that in general medicine, please. I had seen students getting confused and giving lab diagnosis for general medicine. Which part of the paper the question was asked? If the question was about lab diagnosis in microbiology, just write the tables which I give you in the notes. But for general medicine questions, don't write in such a way. Just approach it in a clinical way, investigative way. Try to draw an algorithmic approach to this. Okay. And TB meningitis is a common question. See, meningitis, meningoencephalitis, and TB meningitis. So many questions on meningitis. Again, chronic renal failure. There was a question on ARF. Now they're asking question on CRF. And you all know chronic renal failure because of the TB is a common thing which is happening. So etiology, clinical features, investigations, management of chronic renal failure. Now next is 20-year-old male has presented to medicine OPD. He has complaints of episodes of breathlessness associated with tightness of chest and wheezing since childhood, commonly during seasonal asthma, simple bronchial asthma. And there is most probable diagnosis, yes, bronchial asthma. There is no acute exacerbation now. Okay, just episode of breathlessness and tightness and wheezing, and it is there since childhood. Okay, so it's a classic case of asthma. How will you confirm? You have to do tests for asthma. We do spirometry and bronchodilator challenge test. You have to mention that. What are the clinical features of the disease? You know, and outline stepwise treatment. And for stepwise, in subject-wise test 6 general medicine, we did ask a question on bronchial asthma, wherein in the model answer I gave you GINA 2022 updated guidelines for stepwise therapy. Stepwise, very important. Don't give basic point-wise discussion. Step 1, step 2, step 3. You know the tier, right, which is there in our books. Okay, you have to mention it steps-wise. Different tiers are also there. If you mention your older text, it's okay. But now GINA 2022 is changed. GINA 2022 guidelines are different. Now we are not giving SABA. Okay, short-acting bronchodilator. We are not giving salbutamol for a chronic case. Straight away we are starting with formoterol, that is LABA plus inhaled ICS and a short dose. Okay, straight away when you see a case of bronchial asthma, chronic bronchial asthma, give him inhaled corticosteroids to control the disease plus LABA, that is formoterol. There's no room for salbutamol in adults. That's what is the new GINA 2022 guidelines is saying. In our notes and in our regular steps, we still see salbutamol there, but in model answer I changed it, and according to that in the future editions the notes will also change. Okay, so GINA 2022 guidelines have changed. If you mention older one, don't worry. There's no major change, but only change is this. SABA we're not giving. We're going for LABA plus ICS, controller mechanisms. And terminology also, the control disease is changed. Just go through the model answer of subject wise test 6. You will understand the GINA 2022 updated guidelines. Now, medical imaging, the trend is changing for the last 3 years. Before that, in the medical imaging, you have CT, ultrasound, 2D echo, MRI. This is what is syllabus. Okay. In the most of the times, these are the, so this is there in the syllabus. They used to ask principle, how it works, and advantages and disadvantages before, but now they're asking you what is the role of a particular imaging method in a disease. For example, in our test series, I asked a question on what is the role of MRI in stroke management, like in a stroke evaluation. What is the role of MRI? Similarly, this time in Live GT 2023, I asked a question on what is the role of uh, radiological imaging in respiratory diseases as a whole. What is the role of imaging in maybe cardiovascular diseases? That's what I asked last year, right? What is the role of imaging in cardiovascular diseases? What are the different investigation methods available to diagnose cardiac diseases? So they're asking these kind of questions now. Now you can't learn radiology as a whole for this. What you have to do for these kind of questions is, if you see acute abdomen here, in the syllabus, what are all the topics which presents with acute abdomen? Most importantly, we have cholecystitis, right? Cholecystitis. And what else we have? Pancreatitis, which is again, it's a part of most of them. We have renal stones. Okay, we have renal stones, right? We have renal stones in the syllabus point of view. Very importantly, in cholecystitis, we also have gallstones. We have intestinal thing is there, right? Perforation, bleeding peptic ulcer, and intestinal perforation is there. Yes. This is again a part of the syllabus. Peritonitis is there, again part of the syllabus. Patient presents with acute abdomen. Just look at the various quadrants of the abdomen and think about the possible pathology. Do we have? Yes. What else? Ectopic pregnancy, acute abdomen. Yes, ectopic pregnancy is also there in the syllabus. Just think of the topics which are within the syllabus. So, what kind of X-ray imaging we are using in these kind of diseases? Okay, you have to think of that and you have to present it. Okay, what is the role of X-ray imaging in diagnosing a case of abdomen? When you do these kind of things, you can diagnose these and what kind of features you see, what kind of signs you see, that is in greater detail. But at least you give an introduction like this, that you will get 3 to 4 marks. The greater depth, I'll give you the model answer for this. Based on this model answer, be prepared to give a random answer, because look at the weightage, it is for 10 marks, and where it is asked in question number 4, you can happily ignore this question. But problem is, in last 3 consecutive years, these kind of questions are coming in question number 1. Okay, so that's the problem. You might lose 5 or 6 marks there. So for that, you should be ready with these kind of basic questions. Now I asked about acute abdomen. Next, respiratory diseases. What is the role of imaging in respiratory diseases in general? Cardiovascular diseases. Okay, or neurological diseases. So they're generally asking, you need to understand, you have to frame your answers by looking at various investigations done in these kind of topics which are there in the syllabus. Okay, in a general way. Now dermatology, this time again very easy, but there was one, I'll not call it as a bouncer, but we couldn't predict that, because seborrheic dermatitis was asked this time, because dermatitis and eczema they ask every year. This time yellowish greasy scales and redness over the scalp in a 48-year-old is seborrheic dermatitis. So that was the question asked. Apart from that, this is again a frequent repeat lichen planus. Okay, nothing new. Every year, 2020, 2021, 2022, 2023, maybe they'll ask in 2024 also, I don't know. But it's a second hat trick has started. Okay, here. That's it. The 2 questions, and psoriasis is a common question. Like 3 questions from dermatology, pretty easy. This time weightage was a little less. Last time they asked about 45 marks or 50 marks of derma. This time it's only 40 marks. Lichen planus, seborrheic dermatitis, and psoriasis. Pediatrics, you're lucky. Pediatrics is again very easy this time. Otherwise, there last time look at IMNCA question, that is serious bacterial infections. How do you approach a case based on IMNCA? I thought that they might also ask functional IMNCA. That's why it's a new terminology. That's why I have included this in subject wise test pediatrics. Okay, functional IMNCA. What is the full form of IMNCA? What are its objectives? What are the components? We did discuss this in greater detail. It's a repeat, and it's a repeat question again from the test series. And also, National Immunization Program has changed. For example, in January 2023, they have included IPV dose 3. Okay, now in pregnancy we give TD, not only TT. Right, there are a lot of things changed. Just go with the immunization schedule which is given in the notes. It is most latest. Okay, you have to mention that, and they're only asking for infants and children, so don't need to mention for pregnancy. Okay, it's a repeat again. Now, question number 2: a 2-year-old boy was brought to emergency with complaints of sudden onset of respiratory distress with irritability. Respiratory distress in a 2-year-old. Okay. On examination, child is disoriented and cyanosis is there. It's simple. Okay. Cyanotic congenital heart disease. It's there in the syllabus. You don't have to worry about that. Even if you want to discuss in detail, the weightage is only 2 marks. So you're lucky in that way. Deep sighing respiration and SpO2 is coming down. Oxygen when you give it is going up. No organomegaly, no neurological deficit. This is again pointing towards tetralogy of Fallot, which is most common in a 2-year-old. Any other cyanotic heart disease, the person will die for now. Okay, cyanotic heart disease, probably tetralogy of Fallot. How will you manage TET spell or cyanotic spell? You know, right? It's like most commonly asked question in test series. And classify the congenital cyanotic heart diseases. We did discuss in greater detail. It's a straightforward repeat. Okay. What are the causes of unconjugated and conjugated hyperbilirubinemia? You have to mention the generic causes also, but look at the weightage, 9 marks. I haven't seen this. What else will you do? You have to start with hemolytic jaundice. Okay, what are all the hemolytic jaundice? You see sickle cell anemia, G6PD deficiency. Okay, hereditary spherocytosis. Everything. Like you have to elaborate on the causes. This is one question wherein the causes has got more weightage for 9 marks. There was other question. PPH causes they asked. Postpartum hemorrhage for 10 marks. Maybe the examiner is trying to match up to the weightage of the overall paper, like 250 marks. If they want to make it, they're dividing the weightage not on a good scale. This is actually not right to ask just causes for 9 marks. But when you mention cause, you have to mention the characteristic feature of that particular cause and how will you diagnose it, or physical examination findings for that particular cause. Okay, you have to do that. And what is the mechanism of action of phototherapy? How it will work? You know, right? Structural isomerization. What are the complications which can be seen? You have to cover the eyes. Dehydration can be, burns can be a possibility, right? So these are all the complications. Also, when phototherapy is going on, breastfeeding is at stake. You have to take care of that also, right? Hypothermia can be there. Now, this is question number 3B. Question number 4 is what are the criteria for identification of severe acute malnutrition? Oh, direct from the model answer and notes. Just go through it. Even the admission criteria is also of WHO is given in a flowchart fashion. Next, general surgery, 70 marks. Dysphagia. This is again interesting question. In differential diagnosis part of discussion of video course, we did discuss many of the classic symptoms like chest pain, breathlessness approach, acute severe breathlessness approach, hematemesis approach, right? Hemoptysis approach, even dysphagia also, right? How will you approach a case of dysphagia? Now here you have a dysphagia with significant weight loss. How will you investigate her? It's most probably a case of CA esophagus, and the same question is part of subject-wise test general surgery, right? CA esophagus, and how will you manage a case of upper 1/3 of esophagus? This is what I asked. The same thing, how will you investigate her? What is the role of barium study? What kind of sign you see in barium study? What other things you do for ruling out the various other causes of dysphagia? Okay, so you have to work out on an algorithm. I'll give you algorithm in model answer, but it's again the management of CA esophagus. 42-year-old male known case of alcoholic liver disease with portal hypertension is brought to casualty with severe hematemesis. As I told you, dysphagia management. Now you have to know hematemesis. Repeat question. How will you manage this case? Enumerate the signs of lower limb arterial ischemia. What are the different signs? The claudication, pain, and all. You have to discuss that. Diagnostic workup in a 62-year-old male with atherosclerotic lower limb PAD. Okay, peripheral vascular disease and varicose veins. Very important part from the general surgery. What is the management of this case? It's very simple. Whether the patient requires amputation, it depends upon the cause. Most of the time, the questions were on Berger's disease. They give a story of a smoker there, but here it's different. It's a 62-year-old female with atherosclerotic one. Okay, in atherosclerotic can occur in common iliac vein or internal or external iliac vein. Based on that, we either go for grafting. Okay, if it is peripheral, we go for amputations and all. You have to mention that in the management of the case. Now, this is again offbeat question. PUJ obstruction and also hydronephrosis and all. Maybe there was a in the syllabus they did give about renal tumors, but there's no specific mention of hydronephrosis. Maybe this is, you have to put it in the unasked version and also out of syllabus version mostly, but again hydronephrosis and PUJ obstruction, you can with your basic MBBS knowledge, you can definitely answer this question. What is the management of PUJ obstruction? How will you investigate a case of unilateral right-sided hydronephrosis? What are the causes of hydronephrosis in adults? And again, along with the hydronephrosis, there are other possibilities of radiopacities in plain abdominal. It can be a renal tumor, it can be a ureteric stone, it can be a renal stone, it can be a calcification. Okay, it can be a nephroblastoma, neuroblastoma. So you have to give the possible radiopacities and a plain abdominal radiograph. If you don't know this question, you can happily leave the question number 7 as a whole, as I did. Enumerate the therapeutic indications of splenectomy. It's again a part of splenomegaly. Where do you do splenectomy? In any condition wherein the RBC death is too high, like immunothrombocytopenic ITP, right? This is ITP, and also Feltis syndrome or hypersplenism. So next time they might ask this question on Feltis syndrome, the probable question, because splenomegaly, they're commonly asking questions. In 2015, there is a question on massive splenomegaly and how will you manage, and also after splenectomy, the chances of OPSI or post splenectomy. This question is again a part of subject wise test series. What is the etiopathogenesis and prophylaxis of OPSI? Okay, it's again a question repeat from 2009. So splenomegaly, splenectomy, OPSI, maybe Feltis syndrome next time, or hypersplenism they might ask the predictable question. Then we're getting into the last part of the discussion. Now you have OBG including family planning for 70 marks. Very easy questions. Pelvic organ prolapse, what are the risk factors and how will you manage? Simple. Next, this is again unasked hashtag. It's there in the syllabus. It's actually focusing mainly, where do you see chronic pelvic pain in women? Dyspareunia or chronic pelvic pain, mostly chronic PID. Okay, chronic PID, and in India it's common as TB endometritis, okay, or TB salpingitis. These are the common things, okay, and ovarian tumors. These are the things which you see, but I'll give you a good answer in model answers, but it comes under unasked, but it's there in the syllabus. They did ask about pelvic pain in the gynecology. So enumerate the causes of PPH and discuss the management of PPS. So look at the repeat percentage. But here the causes you have to elaborate. Okay, the PPH causes, atonic PPH and traumatic PPH. What happens in atonic PPH? Why there is atonicity? What happens in traumatic PPH? And why it is important to do active management of third stage of labor, right? Very important. Active management. What are the methods of screening? Pap smear. What are the risk factors? You all know. What are the preventive strategies? That is HPV vaccine. Because a direct repeat from 2022. HPV vaccine and its schedule. CA cervix. CA cervix is a common thing. CA oris, CA cervix. breast cancer. You'll see one question or other. Okay, so it's a direct repeat, and anemia and pregnancy, with major focus of government on nutritional programs and improving the nutritional status of mothers to reduce MMR and IMR. It's very important for a doctor to understand what is anemia and pregnancy, what is its classification, what happens if there is anemia in pregnancy, and how will you manage a case of anemia in labor. It's very important. Now finally PSM was most easiest this time. This is again test series question, and JSSK is a prelims question and also UPSC CMS question, very simple. And NRHM is an old question and it's already asked in the previous grant test. Okay, the same question I asked, and it's a table. You just need to mention what are all the programs we are doing in rural health programs, all the names of the programs including JSSY, JSY, RBSK. There's so many national health programs which are catering to the needs of the pregnancy, mother and childhood, right? So you have to mention those things. Essential amino acids, list any 6. When is protein said to be a biologically complete protein? So this is a repeat, and this is easy. If you're also preparing for PG, you know, right? We also keep some mnemonics to remember essential amino acids list. Okay, so these two parts is easy, 10 marks. What is the supplementary action of proteins, and explain this concept. I'll explain this with the help of a model answer real soon. Okay, it's direct copy paste lines from PARC 26th edition. See this, when is protein said to be biological complete, and how do you compare all these things? Why proteins are needed in the body, that is itself is a supplementary action of the proteins. It's there in the model answer 2021, and I did predict this. It's there in the GT and also the subject wise test 7 PSM and general surgery. They're asking you targets and broad strategies, and it's also UPSC CMS 2022 MCQ. That's it. This concludes the overall paper discussion. I think there are so many repeats. Yes, there is new thing, that is unasked version, and this is not new, actually it happens every time, but this time the weightage is high. So as a target 2024 batch, we should be ready for that. And how to crack this? Just in the search of rare things, you can't prepare 100% and by heart it. Still 85% of the paper is a repeat. Okay, almost 75 to 80% of the paper is a repeat. So if you know those things, and if you can pick your right questions, 1, 3, 5, 7, 8 in paper 1, 1, 3, 5, 6, 8 in paper 2, you can get good marks in this paper. For unasked version, you have UPSC MEDICO. We'll cover them in bits and pieces in videos, notes, and also majorly in the test series along with the live GT. It is very important for you to live GT just to know the unasked version. Even if the paper looks tough, even if UPSC MEDICO papers are tough, the reason for them being tough are we're trying to anticipate and predict new questions, and we were able to do so this time. And all my test series students and combo course students, they are very happy after writing the test that at least they have that 10% edge over the other competitors. Okay, so I have given you a list here with the questions which are not repeats. So these are the few things, and again in the bolder underlined forms are the ones which I did ask in the test series. Similarly in paper 2 also, these are the questions I did cover in the test series. The remaining questions, yes, the future prospects based on these questions along with the overall paper. Now I'll strategize the upcoming model answers, notes upgradation, new notes, videos uploading, and also we'll fine tune the live GT according to the future prediction. Okay, we'll try to predict, and according to that we'll frame the new paper. So this will conclude our overall discussion on the 2023 paper. So again, if you need, it's very important, it's high time for a medical aspirant, because almost 20 plus students have cracked it last time, and almost 120 plus UPSC MEDICO students are writing exam this time. Like in 2023 they attempted it. You need to understand one very important thing, that unless you have financial constraints, go for the support system. In a competitive exam like this, you need to work smart. Okay, you need the ready-made content available so that you can revise. This exam is little bit different from our university exams. Here they need you to give perfect answers in a structured fashion, which only comes with practice. which only comes with teaching, which only comes with the way algorithmic approach, clinical approach, and which only comes with experience. Okay, I don't want you to gain 4 5 years of experience before cracking it. We are available here, we are here to help you. We have combo courses, we have test series available, right? So go for it, give your best. Okay, if you have any questions, related questions, here is my number. Okay, you can either WhatsApp me or call me in this number, or you can email me your doubts about this paper or medical science preparation as in general. Okay, I'm here to help you. As I told you 5 years back, I'm here to stay. So for the last 5 years, I'm uploading this analysis videos in the UPSC Medical YouTube channel exclusively for you, because UPSC Medical Science optional students needs guidance, right? So let's master medical science. Let's give our best.